I'm here representing Dr. Afif, who could not be there today. So we'll be talking about the role of AI and leveraging AI in colorectal cancer screening, booking, and patient preparation. So as of today, a sizable proportion of our colonoscopies are no-shows in the sense that the patient did not present to their appointment for colonoscopy, and there are also a several percentage and sizable proportion of late cancellations, so cancellations that happen too late for us to rebook somebody else. For those who present, there's a non-negligible proportion of patients who are incompletely prepped, so there's a bowel preparation that needs to be ingested the night before, and with incomplete preparation or improper preparation, you're not able to see, which affects your colorectal cancer and advanced polyp detection rates. Otherwise, there's also patients that come in with missed contraindications, so people that take blood thinners, people that take medications that preclude the safety to do the colonoscopy. And so this is also a hurdle that we have to encounter on a regular basis. Just today, we've had a few of those. Another upcoming challenge is one of the MSSS mandate that essentially requires that long-term colonoscopies, so up to 10 years, are managed by our service. Historically, the way that it was done, if a colonoscopy needs to be repeated in 5, 7, 10 years, it would be sent back to the referring physician, the family doctor, who would then re-request the colonoscopy at that time point if it's still clinically appropriate. Now it is our responsibility, and that's something that will create significant administrative burdens. A lot can change in 10 years. A patient at 60-year-old may not be a great candidate for a colonoscopy at 70, may have new comorbidities with new medications, with new instructions that will need to be managed, which will create an administrative burden that we're not quite yet ready to meet. So potential negative impacts of all of that will include delays in cancer diagnosis, higher costs, as well as a poor patient experience and satisfaction. So there's an unmet need, and this opportunity and possibility to leverage AI will help us address these issues. All right, so yeah. We perform thousands of endoscopies on a yearly basis, so having that opportunity, just a 5% efficiency gain would impact hundreds and hundreds of patients. And it would be a first-in-Canada experience with an AI overlay, as it's been mentioned before, so no need to reinvent the wheel or create new EMRs, and it would be able to also just integrate within our current booking softwares. And we'll present and showcase our site as a provincial and national showcase site. So how it would be done, there's 4 steps to it. So there's a booking process. Essentially, the AI would allow to screen for contraindication, somebody who takes blood thinners that may need to stop them a number of times before, who takes medications for their diabetes, like insulin and so on and so forth, and would basically flag patients that are higher risk or patients that may need additional instructions or necessity for further assessment. So that can be flagged to a person who can then triage those patients specifically. And if there's no contraindication, there's no need to go through a booking agent. It can be booked immediately and directly. With regards to the preparation and reminders, the AI can then forward the preparation, the bowel prep, to the patient and reach out to the patient at different time points to remind them of different stages of the preparation and also remind them of the time and place of their endoscopy to ensure adherence. The third point, which is also very useful, is a dynamic wait list. So if somebody calls to cancel, instead of that spot being empty, which happens on a daily basis, essentially what you would have is the AI would screen through the next patient that doesn't have any contraindications and book them directly, thus maximizing and optimizing the use of our endoscopy times. And finally, something that is not currently done is a safety check post-procedure, especially if there was like an advanced polyp resection or a procedure that is a higher risk of bleeding. The AI can check up on the patient within 24 or 48 hours, screen for specific symptoms like major bleeding, and then like direct them to the emergency room or flag them to the gastroenterologist who did the procedure, who can then deal with it as clinically indicated. So the automation of the process would help meet the goals of the MSSS 10-year colonoscopy list mandate safely and effectively. So the AI will be able to independently contact patients, update medication registry, like all the information that we're missing within those 10 years. It'll be able to fill that gap for us without having like a triage person or a nurse call every single one of these patients. So that cuts a lot of administrative hours every year. And this is a unique value proposition in the sense that it comes like right at the time where this challenge is coming to us. In terms of benefits, there's quite a bit of literature showing that just text messaging systems or reminder systems help reduce late cancellations in the order of more than 30%. There will be reduction in wait times that are expected thanks to the dynamic booking process. Also a potential for amelioration of bowel preparation adequacy, which is a significant issue. And then an opportunity to ensure stronger patient adherence, patient cooperation, and collaboration so that they can feel more active in their care. And obviously reduce staff workload and compliance with current requirements, both in terms of privacy and in terms of legal requirements. So there's a bunch of evidence. I won't go necessarily through it all, but text messaging system has been linked to decrease in dropout rates, has been associated to improved adherence to endoscopy and better bowel preparation. Automated wait list, dynamic wait list, et cetera, also associated with shorter wait times in endoscopy in a number of sites in the United States. In terms of the implementation plan, the goal is to start in January 2026. So the first quarter would be just 100 patients with the goal of implementing the AI booking system and the text messaging or email reminders. In the second quarter, the idea would be to have up to 500 patients, and that's when we would roll out the wait listing, as well as the registry for more long-term planning. And then finally, in Q4 or so, a full MUHC, so the McGill University Health Center deployment and preparation to be involved in more centers. So won't go necessarily into the cost, but the funding will come from different areas. So from the ministry, pharmaceutical industry, as well as MUHC and funding from different grants. There's long-term sustainability to it. It will be shared by all these stakeholders that I mentioned. And then in terms of governance and safety, safety is a big issue. We've mentioned the idea of like leaving it all up to AI. There is always a human in the loop. So everything that is flagged that will be necessary can then be flagged to the nurse or a clinician that's trained in the procedural management and then booking agents if need be. Monthly audits in how we're doing and how the effectiveness is going. Escalation protocols in terms of serious adverse events or adverse events as a safety check, and importantly, the compliance with our current regulation systems. With regards to the leadership team, Dr. Waqqas Afif, who couldn't be here, but at least you see him, and Dr. Asela right here. That's it. So in closing, the vision and the goal is to have a system in which we can leverage AI to help reduce missed colonoscopies, to improve colorectal cancer and advanced polyp detection rates, and finally to save lives ultimately. So thank you very much.